Imagine a young woman named Sarah, a vibrant college student with a passion for life. One day, Sarah wakes up feeling unusually unwell. She has a pounding headache and a fever. As the hours pass, her condition worsens. The headache intensifies, and she experiences a stiff neck, making it painful to even move her head. Nausea sets in, and she vomits several times. Confused and frightened, Sarah's friends rush her to the emergency room. At the hospital, doctors immediately recognize the seriousness of Sarah's symptoms. They perform a battery of tests, including a spinal tap, to analyze her cerebrospinal fluid. The results confirm their suspicions. Sarah has meningitis, a potentially life-threatening infection of the meninges, the protective membranes surrounding the brain and spinal cord. Sarah's story is a stark reminder of the importance of recognizing the symptoms of meningitis and seeking immediate medical attention. Meningitis can strike anyone, regardless of age or health status. It is an inflammation of the delicate membranes that protect the brain and spinal cord, and it can have devastating consequences if left untreated. Meningitis is most often caused by a viral or bacterial infection. Viral meningitis, while unpleasant, is generally less severe than bacterial meningitis and often resolves on its own with rest and fluids. However, bacterial meningitis is a medical emergency that requires prompt treatment with antibiotics to prevent serious complications like brain damage, hearing loss, or even death. A less common but equally serious form of meningitis is tuberculous meningitis, caused by the bacteria responsible for tuberculosis. This type of meningitis often affects individuals with weakened immune systems and requires a long course of treatment. Meningitis wreaks havoc on the body by causing inflammation of the meninges, the protective layers surrounding the brain and spinal cord. This inflammation triggers a cascade of symptoms, including the classic triad of high fever, stiff neck, and severe headache. Other common symptoms include nausea, vomiting, sensitivity to light and sound, confusion, and altered mental status. In severe cases, meningitis can lead to seizures, coma, and even death. It's important to note that not everyone with meningitis will experience all of these symptoms. The presentation of the disease can vary depending on the type of meningitis, the age, and overall health of the individual, and other factors. Diagnosing meningitis quickly is crucial for effective treatment. Doctors will begin by taking a detailed medical history and performing a physical exam, paying close attention to neurological signs and symptoms. A lumbar puncture, also known as a spinal tap, is the gold standard for diagnosing meningitis. This procedure involves inserting a needle into the lower back to collect a sample of cerebrospinal fluid, which is then analyzed for the presence of infection. Other tests, such as blood cultures and imaging scans like CT or MRI, may also be ordered to confirm the diagnosis and rule out other conditions.